At West Valley Medical Center in Caldwell, Idaho, people who work with Fred Webster call him the Fix-It Guy. There is a reason why. His recent innovation has changed the way surgeries are scheduled at this hospital.
When we input a surgical case, all that information's there. Anybody can go get it. But how do you know to look? So what this does is it tells people, hey, you need to look, and in case you didn't, here's what it says.
In the past, surgery was scheduled manually by phone and email, which took lots of time and left scheduling open to human error. From financial counseling to interpretive services to post-op education, Fred found a way to use the current database and automate communication between the operating room and other departments.
But it saves them so much time on the back end. Before they were sending multiple emails to all these different parties about this patient and this surgery and that, and they don't have to do that anymore. It's all built into the program. They put in the information, they click a button, and it emails the people that need to know.
I think the staff loves it. It's made their lives easier, and one of the things I think is a real testament to how well it's working is that we find new uses for it all the time. So we're using the same database and the same concept deployed in new ways.
The result has been fewer scheduling errors and improved patient experience. That is why Fred Webster is this year's HCA Innovators Award recipient in the category of Service Excellence.
I'm really proud of you, Fred, and congratulations, and thank you for being a guy who just fixes it all the time.
That freedom to do what needs to get done is really something that's special, and I appreciate that more than anything.
The staff at Johnston Willis Hospital in Richmond, Virginia is always working toward improving patient safety and satisfaction scores. One way they are doing that is through an innovation called IV Guardian. Created by a team led by Sean Albert and Hunter Davis, it ensures IV pumps are programmed exactly the way physicians order, reducing potential errors.
1 in every 10 IV administered is in error, and we want to communicate that back to the nurses. We developed a on-screen alert at that moment that the nurse had an error. That way they knew to correct something.
The nurse scans the patient, scans the medication, and scans the IV pump. This allows the system to capture how the pump is programmed again to verify everything is correct. The data has shown patient safety has improved, as well as workflow for nurses. And it's simply quieter on the floors due to fewer alarms.
It proactively notifies the nurse, and then the nurse can act on that.
Whether a bad battery or incorrect dosage, nurses are alerted by a color-coded system immediately and can quickly correct it if needed.
This is an inspiration to our team that ideas that come out of our hospital can really add value and affect patient safety across the country.
Technology that prevents potential harm to patients has been the result. It's why Sean Albert and Hunter Davis are this year's recipients for the HCA Innovators Award in the category of Quality and Patient Safety.
That's probably the most meaningful part about my job right now is getting up and knowing I have a chance to impact patient safety and care.
Always moving, always thinking, always questioning. Clinical pharmacist Mohammed Elian's idea about changing the way patients receive chemotherapy doses is having a big impact at TriStar Centennial Medical Center.
We don't want to compromise the effectiveness of the chemo, and we definitely don't want to increase any toxicities that are related to the chemo. We haven't decreased efficacy and we haven't increased any toxicities, and so that's a win-win from that perspective, and we've saved money.
Mohammed created a formula to stagger chemotherapy doses. The process used before his innovation wasted expensive medication. Mohammed's formula to stagger doses ensures the patient receives the same total exposure, but no vials are wasted. In the past, 3 100 milligram vials would be opened every day to administer 250 milligrams to the patient for 4 days each, wasting 50 milligrams each time. Now patients receive 300 milligrams for 2 days and 200 milligrams for 2 days. Same amount of medication, but 2 vials saved.
A very simple concept, but no one had kind of thought about it. He has such a great attitude and, patients love him. He goes and talks to them, and the feedback that we get from the interactions that he has with patients, it is just great.
Had the opportunity to share with Mohammed that he won the award a day after he had the birth of his first son in our maternity unit. At the same time, share with him that his idea is going to possibly be recognized nationally and the impact it's going to have on patient care. And it was a great opportunity and great experience to have that conversation with him.
Mohammed Elian says he has more ideas in the works. That is why he is this year's recipient for the HCA Innovators Award in the category of financial impact.
I was able to do it essentially because I work with such a great team. I'm incredibly humbled by it, incredibly flattered.